I'm John Strum, and this is Real Talk MS. It's April 1st, and we have a lot to talk about. And unfortunately, one of the things we have to talk about is how the president's mass firings and wholesale budget cutting across all federal government agencies could impact people affected by MS. I guess first I want to get a couple of things out of the way, sort of lay the ground rules, because we'll probably be talking about this stuff into the foreseeable future. And to begin with, I'd rather not be talking about this stuff. I think there's so much encouraging research to discuss, important scientific advances that are taking place at warp speed, advances that are bringing us better treatments today, as you're going to hear about in a minute, while also bringing us closer to cures in the future. Those are the kinds of things I want to be discussing on this podcast. You know, this sort of reminds me of the COVID-19 pandemic. There was a lot of important information to share with you during the pandemic because there was so much misinformation being posted online and even being shared by our president. What's always been most important to me is that you'll always find the truth here, information you can rely on, even when it's upsetting, even when it ends up sounding partisan or political. This is a podcast that's going to rise above the noise, the sketchy social media posts, and the opinions that are out there masquerading as fact, and give you information that you can use, knowing it's 100% fact-based. The other thing I need to say is that the conversation about what's happening to our country's healthcare infrastructure can't really be nonpartisan, because the effort to dismantle and defund the agencies that are tasked with our public health and scientific research, well, that isn't nonpartisan. Only one of our political parties has voted to slash federal spending to the point where the Congressional Budget Office has said quite clearly that the only way the budget that was passed by the House of Representatives can be realized is if deep cuts are made to Medicaid, a healthcare safety net that provides care for about 15% of the people with MS in this country. And I guess I can't quite process what happens to someone who's living with the everyday uncertainty of MS when that safety net disappears. It can't be nonpartisan when the president has issued executive orders gutting research funding for the National Institutes of Health, an order that's literally bringing research studies to a full stop. He's fired over 3,000 people at the FDA, another 1,200 people at the NIH, and even the Centers for Medicare and Medicaid Services will lose a few hundred employees. None of this is nonpartisan. So when we talk about it, because we must talk about it, it won't sound like a nonpartisan conversation. But I can promise you, it will always be 100% fact-based and true. All of this is top of mind for me because last week the National MS Society hosted its public policy conference in Washington, D.C., bringing together a couple of hundred MS activists to have over 200 conversations with our congressional representatives about the importance of funding MS research and protecting Medicaid. I was at the public policy conference, and during one of the breaks in a day of presentations, panel discussions, and speeches, I talked with several attendees about how they were feeling and what they wanted to share with their elected representatives. Rather than tell you about those short but insightful conversations, I want to share a few of them with you. So in a moment, you'll meet a few of the new friends that I met last week at the public policy conference: Paula, Katie, Sarah, Veronica, and Allie. I'm talking with Allie from Michigan at the MS Society's Public Policy Conference. What's important about being here this year?
Just to show up and to share stories, to see and hear, get just a feel for the landscape that has been very confusing as of late.
How many appointments do you have tomorrow with legislative offices?
We have 2 secured, so 2 meetings that we will be going to. We will have audience. We will be seen. We will be heard. So we're excited for those opportunities, for sure.
And what do you want to share with them?
I want them to see, to hear, to feel the needs of the MS community. And I think it is by sharing our stories that will help them understand and feel it. I think we can throw stats at them all day. I think when they hear some of these stories that we have about the real impact of Medicaid, of the MSRP, of all of these things, and we can give them personal stories to help them remember and not forget. That's what my hope for tomorrow is, to be remembered.
What's your message to people who are listening who can't be here at the Public Policy Conference?
We've got your back. We are doing what we can. We are showing up. We are painting the Hill orange, and we are here in force with passion and with lots of questions, and that we will find answers for one way or another.
So I'm talking to Sarah from Arkansas. Sarah, what makes this year's Public Policy Conference feel a little different than previous years?
I would say the big topic is finance. Financing our researchers, and so they can continue to research multiple sclerosis. This makes it a big difference. It's always been a hot topic, financing, funding for research, but now it's even greater with all the budget cuts that have happened now. And everyone being educated and come together and understanding how we can get not only federal funds, but also getting private funds, a different direction that the MSI is coming together to, but also talking to our local politicians in our state. And if you know any from other states, talking to them and saying, how can we all work together? How can we keep Medicaid for each state? How can we keep Medicaid for the United States of America? Because we have a lot of MS patients. We need it to cover our medication. We got a lot of caretakers. That's what helps them take care of their husband or wives, that we had one of the speakers today. So what's really making a difference is a different thought process on how do we finance that research? How do we finance taking care of ourselves with just basic needs? And I think that focus has really changed a lot this year.
How many appointments in legislative offices do you have tomorrow?
I have 9. So I'm not even just doing my state. I'm also talking to people from other states as well. In my past life, I've worked in politics on both sides of the aisle. So I'm trying to bring everyone together. That's my joy, is to be a balance and try to bring everybody to the table and say, how can we work together on this? Because as someone who's worked with all of you, this is affecting me. I need you all to come together so we can make a better place for all of us here who have disabilities.
I'm talking to Veronica from Virginia here at the MS Society's Public Policy Conference. Veronica is a district activist leader. What does that mean?
So I have worked with the MS Society at the Public Policy Conference and in a couple other groups associated with the MS Society to work on advocacy for policies that affect people with MS, that work towards a cure for MS and the MS Society initiatives.
What's your impression of what's been happening in Congress and how it's affecting people with MS?
The things that are happening in Congress are having a dramatic impact on people with MS. The funding that we have counted on that's doing research on disease-modifying therapies and on there's a big initiative or a big research right now being done on fatigue associated with MS. The funding for that is being cut, and it's a dismal situation for the MS community because we've relied on that funding, and the funding that has been done through Congress has impacted all of the disease-modifying therapies that we have so far. So the fact that funding has been cut is a huge blow to the MS community. And we're working to rally, and we get an opportunity to go talk to Congress and share our stories. But it's tough right now.
Right. How many appointments in legislative offices do you have tomorrow?
I have 3. I get to talk to Senator Warner, Senator Kaine, and Representative Jerry Connolly.
What do you want to tell them?
I want to tell them that I've had MS for 20 years, and the disease-modifying therapies that I've been on have all been funded by Congress, and we need to keep at it so that I can continue to have drugs that positively affect my MS, and so that future generations don't have MS to deal with.
I'm here with Paula from Ohio and Katie from South Carolina. And Paula, let me ask you, how many appointments do you have tomorrow?
We have 7 tomorrow. So that's going to be, a marathon. Right.
And what do you want to tell the legislative offices you're meeting with?
I want them to focus on the resilience and hope that we must have, and their support that must be there, and critically important for Medicaid and other focus topics that we'll have.
Katie, how many appointments do you have tomorrow?
We only have 3, but we always stop into all the other congressional offices while we're there. And actually year before last, we met a chief of staff for one of our representatives who was living with MS. So it always pays to stop by.
You're right. And what's your message to the legislators you're going to meet with tomorrow?
I think my message over the years is turning into, I'm here, do not ignore me. The people in your district are living with MS. We want to stay productive. We want to be part of the workforce, and we want to take care of especially our veterans who are disproportionately affected by MS, and we cannot ignore that fact.
Paula, you were just part of a panel that talked about the proposed cuts and the devastating cuts in Medicaid. How do you see that affecting people in Ohio?
That's a great question. First and foremost, I think I want to know the percentage that are on Medicaid so that I can align that to members, because I think it's misunderstood the impact it would have if there are cuts.
I think it becomes pretty scary. We always talk about Medicaid as a safety net program. Mm-hmm. What happens to people when there is no safety net?
Yeah, that's terrifying. I think the older I get, the more I've known people who've used it for a short time, or I have friends who have kids with significant disabilities who rely on Medicaid as the backstop to their private insurance. It is so important that the continuity of care exists, and that's what Medicaid supplies for these families. It still takes a lot of work. It still takes a lot of money from the family, but it helps them stay out of poverty, and it helps their kids receive the best care possible.
Mm-hmm. The public policy conference may have ended, but the need for advocacy has never been more important. If you haven't yet signed up to add your voice to our efforts, I'll invite you to visit nationalmssociety.org/advocacy and sign up to be a part of this incredibly important effort. While we're talking about things that are important to people living with MS, I'll remind you of the importance of being proactive when it comes to your health and keeping up with your regular health screenings. Research has shown that compared to healthy people, people with MS are more likely to develop some cancers. And joining me today is the lead researcher in one of those studies, Dr. Ruth Ann Marrie. We're discussing the importance of being screened for certain cancers, where you can find low-cost and even no-cost cancer screenings, and some of the lifestyle choices you can make that can reduce your risk of developing some cancers. But before we get to my conversation with Dr. Marrie, there are a few other things that you should know about. Last week, tolebrutinib, an investigational oral disease-modifying therapy from Sanofi, was granted priority review by the FDA for patients with multiple sclerosis. Now, priority review means that the FDA will accelerate its evaluation of tolebrutinib, completing that evaluation in 6 months instead of the usual 10. The FDA has set a target action date of September 28, 2025 for their decision. Sanofi conducted 2 separate clinical trials, one that focused on the effect of tolebrutinib on people with relapsing remitting MS, and another that focused on the effect of tolebrutinib on people with non-relapsing secondary progressive MS. If you'd like to hear about the results of each of these trials from the principal investigators themselves, you can check out 2 of the interviews I did from ECTRIMS last fall when the clinical trial results were first announced. You'll find links to those videos in today's show notes. Based upon the outcome of each of these phase 3 clinical trials, Sanofi is requesting FDA approval for tolebrutinib to treat 2 different indications. They're requesting approval for tolebrutinib to treat non-relapsing secondary progressive MS, and they're requesting approval for tolebrutinib to slow disability progression independent of relapse activity, known by the acronym PIRA. Now, before you say, gee, don't we already have more than 20 already approved disease-modifying therapies? I want to take a minute to explain why this is big news for the MS community. First, tolebrutinib represents a new category of disease-modifying therapies called BTK inhibitors. The BTK stands for Bruton's tyrosine kinase, which is a long name for a protein that plays an important role in the development of B cells. A BTK inhibitor blocks the activity of this protein, and what makes tolebrutinib particularly important is a BTK inhibitor can cross the blood-brain barrier so it can target B cells in the central nervous system, which is something that, as of today, no other DMT can do. So, if approved, tolebrutinib would be the first and only brain-penetrant BTK inhibitor to treat non-relapsing secondary progressive MS and slow disability progression independent of relapse activity. A regulatory submission for tolebrutinib is also under review in the European Union. If you're living with MS in the United States, you can mark your calendar for the FDA's approval decision for tolebrutinib on September 28th. And I just want to call out that approval will coincidentally occur during the 2025 ECTRIMS conference, which is the largest MS research conference in the world. So I think we can predict what the buzz will be about at ECTRIMS this fall. You can be assured that September 28th is noted on my calendar, and we'll keep you updated as tolebrutinib approaches the final milestone in the drug regulatory process. Prognosis is defined as the likely outcome or course of a disease, and clinicians have long understood the difficulty of making an accurate prognosis for someone with MS based upon how they appear in clinic. As we've often discussed on prior episodes of this podcast, many different factors can affect someone's MS journey, including their age, sex, social determinants of health. These are the conditions in which people are born, grown, live, and age. All of these variables have been shown to contribute to how MS impacts an individual. So the more a doctor knows about these variables, well, the better their prognosis can be. Understanding variables like gender, race, ethnicity, coexisting diseases, and other social determinants can not only benefit people with MS in the clinic, it can also benefit MS research. A review of clinical trials of MS disease-modifying therapies showed that 90% of the participants were white, and that doesn't provide researchers or clinicians with enough information about how a DMT is going to affect everyone living with MS. Lacking this information, the seeds of healthcare inequities are planted. So a research team in Canada wanted to answer 2 questions. What are the diversity-related characteristics of the MS population in Canada? And what are the gaps in knowledge of the diversity of the MS population in Canada? They started by looking at every MS research study that had been done in Canada from January 2010 to January 2024, and they were able to identify 259 published studies. 92.7% of these studies reported the age of the study participants, and 86.9% reported the sex of the participants. Now, all gender reporting was binary, and there were very few studies that included people over the age of 55, even though people between the ages of 55 and 65 represent the largest group of people living with MS in North America. The researchers concluded that the characteristics of people with MS are underreported and therefore poorly understood. Now, if you'd like to review the details of this study, You'll find a link in today's show notes, and you'll also find a link to Sharon Roman's excellent plain English version of this study. Recent research has shown that people with MS are more likely to develop certain cancers. Dr. Ruth Ann Marrie joins me in a moment to discuss which cancers pose a greater risk to someone with MS, why you need to make those appointments for cancer screenings, where you can find low-cost or no-cost cancer screenings, and things you can do to further minimize your risk of developing cancer. Living with MS requires proactive care, from managing routine health screenings to staying ahead of potential complications and prioritizing your overall well-being. Preventive care and regular screenings are crucial for people who are living with MS, especially when it comes to early detection of potential health concerns. Dr. Ruth Ann Marrie, a professor of medicine and the Multiple Sclerosis Clinical Research Chair at Dalhousie University in Canada, is joining me to discuss the importance of cancer screenings and other preventive measures, along with strategies to help proactively manage your health. Welcome back to the podcast, Dr. Marrie.
Thanks so much for having me. It's been a long time.
It has. I'd like to dive right in and ask you to share your recent research on cancer incidence among individuals living with MS.
Yeah, thanks for asking. So we did a large study using health claims data in 2 Canadian provinces. So health claims data are the data generated when you see a healthcare provider, you get hospitalized. They're what help insurers or health systems manage data, and you can get anonymized versions of those data. So we were able to access information for almost 54,000 people with MS and 5 times as many people without MS. And then we looked at the rates of cancer. And we were happy to see that for the most part, the common cancers and overall cancer risks did not appear to differ for people with and without MS. So breast cancer, colorectal cancer, lung cancer, those risks were the same. We did see higher risk of bladder cancer, and we also saw a higher risk of brain cancer, but this looked to be more identification of benign kinds of tumors like meningiomas, which we attributed to the fact that people with MS get many more MRIs than people without MS.
A recent French study identified a potential for increased rates of certain cancers in people living with MS. What can you tell us about that study? And I guess specifically, what do people living with MS need to know?
Yeah, so the French study also used health claims data, but they had a population from really covering all of France. So they had over 140,000 people with MS, or really the largest study we've seen, and slightly over 500,000 people without MS. They, similarly to what we found an increased risk for bladder cancer and brain cancers. And those 2 findings have been pretty consistent across other earlier, smaller studies. They also reported an increased risk of cervical cancer, which we had not seen in our study. I think broadly for people with MS, this highlights, when we're thinking about bladder cancer, the importance of preventing urinary tract infections and having regular follow-up with a urologist or provider who's paying attention to the bladder risk issues if you have an indwelling catheter, so a catheter that remains in your bladder because you can't empty it regularly. And I think also just highlights the general importance of cancer screening in people with MS because the risk of cancer wasn't lower.
Speaking of cancer screenings in general, what do we know about cancer screening rates among people with MS compared to the general population?
Well, unfortunately, both our study in Canada as well as the French study showed that people with MS are less likely to get cancer screening. So looking at mammograms and Pap screening. So in Manitoba, for example, only 60% of eligible women were getting mammograms. And we've also found that women with MS, therefore, are more likely to have their breast cancer detected through symptoms than through screening. And really, in terms of optimizing your outcomes, we want to detect your cancers as soon as possible before you're really symptomatic.
Are there specific factors that contribute to the differences in these screening rates?
think there are likely several based on studies people have done looking at individuals who may have physical impairments that limit their ability to get screening. So if you think about if you're someone who's in a wheelchair who would have trouble transferring up to those tall exam tables to get your feet in stirrups for a pelvic exam, or you would have trouble standing independently for a mammogram, those become impediments to getting cancer screening. And if your closest provider doesn't have offices that are accessible or adapted for those things, that means you have to go further or work harder to get to your screening. And as soon as you have to go further from home, that starts adding in the transportation time and the costs and the need to have somebody help you and some of those other kinds of issues. I think another important issue is people with MS often already have lots of visits related to their MS, maybe taking lots of medications, and already have lots of things in their mental Rolodex that they have to keep track of for their MS. So adding in one more task, for screening can, I think, be an additional impediment to fitting that into their healthcare.
Bladder and or bowel spasticity are common in MS, and consequently, people living with MS may struggle with incontinence. Thinking about getting screened for colon cancer, getting that colonoscopy, there's a concern that the prep for that colonoscopy is going to impact an individual's incontinence. Are there options available that can make colon cancer prep and screening less stressful for someone who's already dealing with stressful symptoms?
Yeah, so I think there are a few things to think about. So first is to tell your healthcare provider that that's a potential concern so they can work with you on that. A few days before you're doing the actual main preparation, it can be helpful to think about switching to a lower fiber diet. So that will, reduce the sort of intensity of the bowel emptying that needs to occur when you're doing the actual prep phase. There are bowel preps that you may be eligible for that don't require you to drink the 4 liters of fluid and instead may allow you to drink a couple glasses of fluid with something added to it. And then planning can be helpful. So planning to be close to a bathroom, planning to have some extra incontinence products available, planning not to be trying to do other things during those days can be helpful to make the experience more manageable.
It's hard to talk about healthcare in the United States without considering its financial impact. Do private insurance companies or Medicare cover the cost of health screenings? And while we're talking about cost, are there any cancer screening programs that are free for patients?
Yeah, so this is an important question in terms of access to care. So Medicare covers screening mammograms annually if you meet the age criteria. And they'll cover Pap tests every 5 years, I believe, if you're between the ages of 30 and 65. Under Obamacare, private insurers are also required to cover screening mammograms. In countries outside the U.S., Canada, many European countries have free risk screening programs. And then if you move back to the U.S., if you don't have insurance at all, the CDC has a national breast and cervical cancer early detection program, which offers free or low-cost mammograms to people who are under or uninsured and have low incomes. And the Prevent Cancer Foundation has a link to a list of organizations that can provide people with support to get access to these really important services.
I know my listeners always appreciate hearing about the things they can do for themselves that will help optimize their health. Can you share some lifestyle behaviors that can help reduce the risk of cancer from developing?
Yes, so tobacco is a big one. As we know, it's associated with a number of increased risks of cancers. And there are, of course, supports that can help people quit smoking if they need it. A healthy diet is also very important for cancer prevention. And in that respect, we're talking about getting lots of fruits, vegetables, whole grains, and trying to reduce the intake of red and processed meats as well as highly processed foods. Being physically active to the extent that you can is important. So if you're unable to walk, upper body exercises are an important aspect of cancer prevention for you. And then trying, insofar as possible, to aim for a healthy weight. The nice thing about these activities, all of which require some commitment and effort, is that they do have benefits for MS as well. And they can also reduce the risks of other chronic conditions like diabetes and high blood pressure.
Dr. Ruth Ann Marrie, I want to thank you for all you do in the lab and in the clinic to improve the lives of people living with MS. And thanks so much for talking with me today.
Thanks for having me.
That's going to wrap up this episode of Real Talk MS. Real Talk MS is powered by the National MS Society. And you can share this episode of the podcast by letting your friends or family members know that all they have to do is point their web browser at realtalkms.com/396. You'll find that link in today's show notes so you can easily copy and paste it into an email or a text. And if you have a minute, I hope you'll visit the Apple App Store or the Google Play Store and download the free Real Talk MS app for your iOS or Android smartphone or tablet. It's the best way for us to stay connected. The app will automatically download the latest episode of Real Talk MS. You'll be able to access any of our past episodes. You'll be able to save your favorite episodes. And it's a great way for me to share bonus content with you. The app is free, so I hope you'll download it today. I'm John Strum. Thanks for listening. Stay safe and make healthy choices.